That's the huge challenge with all this stuff. So whether you're talking about even consumer wearables, the amount of information coming in is massive. And one of the big challenges, even with that really quote unquote simple data, is how do you find the needle in the haystack? How do you find that important piece of information that says to you either everything's fine or everything is not fine, and separate that out?
You've heard of these lifestyle devices. They're actually called consumer wearables. Well, they monitor your vital signs such as your pulse, oxygen levels, blood pressure and body temperature. Well, that data, should clinicians wish to use it, may not be accurate enough. But that is where medical wearables come in, which are effectively cardiac monitors collecting massive amounts of patient data that make the data actionable and meaningful for a clinician. Critical when you think about it, as cardiovascular disease is the #1 killer in the world, and COVID-19 has exacerbated that. Dr. Derek Exner, whom I'm about to talk to remotely from Wauwatosa, is a cardiologist who's an expert in this very subject.
Dr. Exner, it's great to chat with you today. Look, to start with, I'd love to get your definition of what medical wearables are and kind of why they're so important.
Medical wearables are a whole spectrum of things. You might have things like consumer-grade electronics that give you a glimpse in terms of what your health status is, versus specific medical grade electronics that provide very detailed information about the heart and other parts of the body that you use to make decisions in terms of what medications to use, what kind of things to do, what kind of interventions to do.
And what type of data are we talking about?
The ranges is your imagination is a limitation. So it might be things as simple as picking up your activity level. So that's a common wearable, things like a fitness tracker, through to things that are measuring, detailed signals of your heart's activity, your brain's activity, and other vital organs.
There are many, many consumer wearables that are on the market right now, and their evolution has actually been quite staggering. I mean, the Apple Watch, Fitbit, Garmin, all have these sensors that track those elements of the vital signs that we're talking about. Why are consumer wearables not part of the solution here?
If you want sort of simple measures of, are you up moving around? Are you doing activity? What is your average heart rate at a certain period of the day? Then the consumer-graded wearables are certainly sufficient for that. I don't think you don't need something that's terribly sophisticated. However, if you want to decide, is this person going to have a dangerous heart rhythm? Are they at risk for a stroke? Those kind of really important questions, then you want to make sure the information you have is very accurate. That's the big difference between the consumer grade and the medical grade. And the problem is that as you try to apply consumer grade wearables to diagnosing conditions, the problem is that even if they have pretty good accuracy, meaning they're 80% correct, 20% of the time they're not.
Talk me through the access to that data and how that data is being prioritized to make sure that you see what you need to see in priority order.
Let's start with the actual devices. So this is an example of such a device. This is called a Holter monitor or ambulatory ECG. And it's a little box with a memory chip and some batteries and a simple signal processing algorithm. It's connected to these things here, which attach to the skin. And if you look at that thorax behind you, it's got a bunch of these electrodes already attached. So that's an example of how these little wires attach to the body. So they're basically looking at electrical signals from multiple parts of the body. So from that, you can tell, A, this is a very time-consuming process. This takes a lot of time and effort. And B, you better make sure that your ability to sift through that data is as good as you want it to be in order to be able to find that magical needle in the haystack. It's a manual process, but we're working on how does one use artificial intelligence and machine learning to optimize that process. Right now, we're using just standard algorithms that have been around for a number of years, obviously have been improved over time. But the next step of this process is how do you implement a much more efficient approach, artificial intelligence, machine learning approach, to make that even faster and better than it is today.
So how is this crucial requirement being met? Well, Ashutosh Banerjee has been working behind the scenes for most of his career on exactly this. Ashutosh.
Hi.
How are you? Good to see you.
How are you? Yeah.
It's almost been a year. Yeah. I've just been speaking to Dr. Derek. There is a ton of data that is now coming from medical wearables. ECG information. How are you managing all of this data and how are you processing it to help people like Dr. Eric Exner out?
Very simply put, if I'm a patient, I'm taking, let's say I'm taking ECG on my watch, right? I notice something which is wrong. I just go into my doctor, and I do not need to have to tell the doctor, hey, here is my app that has that ECG. Why don't you take a look at it? He should be able to see it all in his system, and then tell me, okay, I see you took an ECG on this and this date at home, and I see that you came in last time here in the hospital. Here's the difference, and here's what we should do for you. And oh, by the way, my system tells me that we should take a look at your ultrasound as well because you had some issues the last time. Today, that doesn't happen. So what we are trying to do is integrate data from various sources, bring them into one ECG management system or one EMR, and make sure that we can provide insights to the clinicians with the set of algorithms that we have. Those insights need to be actionable, and that's what we are trying to do.
There's more and more data becoming available. How do you support clinicians and design something that will allow them to sift through that data quickly and get to the important stuff?
What we are working on today is making the continuum wider. So not just in the hospital with devices like these, but outside. And the outside world, comprises of tons of variables, right? So we want all kinds of data to come in. And all kinds of data need to speak one language. And that's what we are working on. How do we apply our algorithms, which are 510(k) cleared, medically relevant, high accuracy, on all data coming from outside, so that when a clinician sees it, they are sure that the data coming from outside is interpreted the same way as the ECG from the hospital. And then they can rely more on the data and they can be more assured that the data is right and they can take the right decision. We do that through our ECG management system, bring in everything into our ECG management system, provide one pane of glass for the clinician to look at it.
Ashutosh, I know you've got decades of experience on this subject, so really appreciate your time today. Thanks.
Thank you, Mikey. It's always a pleasure speaking to you.